pandemic started and we realized the depth and the length that this pandemic would take, researchers at Penn State wanted to leverage all the expertise that we had on campus to provide science and evidence to inform the actions that could be taken to help both our community cope and recover from this, as well as our student population and obviously the Penn State community more broadly. So the Data for Action project has three components. We started with this really large Center County-wide survey that involved over 10,000 community members. From there, we recruited a resident cohort that we're collecting both survey data from, but also biomarker data from. And we're hoping to begin enrollment with a student cohort, again, where we'll collect biomarker data and survey data about the social, behavioral, educational implications of the pandemic. So it's really combining and leveraging lots of different institutes and research traditions on campus.
And we're going to be able to look at these complex relationships in a very unique way that we feel pretty excited about, because not a lot of folks have had the wherewithal to put a study like this together, grassroots, and get it launched. So I think we're going to have some really, really informative information for not only Penn State community, but the U.S. at large.
Because this won't be the last health crisis or infectious disease that we see, sort of coming our way. So we'd love to sort of establish this as a model for other university towns, for other towns that have populations that move in out. So you could see like beach towns, resort towns, border towns, military towns with military bases. This has a broader set of implications.